Hello dear colleagues, we welcome all those interested in sturgeon breeding and rearing to the first part of the web-intensive course, Ultrasound Diagnostics of Sturgeon, which will be devoted to describing the basics of ultrasound examination techniques for sturgeon, in particular the technique of placing the transducer, choosing the location and the scanning plane, as well as the basic principles of sonograms analysis. In the course of today's webinars, we will consider the basics of ultrasonic diagnostics of sturgeon, including issues related to the correct positioning of the transducer and the choice of location and scanning plane, peculiarities of displaying internal organs on echograms, and difficulties that those who are just beginning to learn this method may encounter. In the final part, we will use video sonograms to analyze possible mistakes in putting the transducer and carrying out the diagnostics. For those who want to go straight to the definite part of the web-intensive course, there is a brief description of the beginning and the end time under the icons of each section. For those who are trying the ultrasound diagnostic technique for the first time, we recommend reading our introductory session on the features of different types of ultrasound transducers. We will begin this session with a brief introduction to the main elements displayed on the ultrasound scanner screen that will be important to us when performing diagnostics. So, what do we see? The first, of course, is the area of the sonogram, which occupies the main space of the screen and in which, based on the signal from the transducer, the structure of the tissue through which the ultrasound passes is displayed. The second, scanning depth. This is an important parameter, the correct choice of which the reliability of diagnostic results depends. Third, ruler. An important tool, especially when selecting mature females. However, even when working with immature fish, the ruler will make it possible to estimate the size of the gonad and thus, for example, evaluate the dynamics of generative growth. On the screen of all ultrasound scanners there is such an element as a ruler. It is located on the side of the main image for convenient measurements. In the left part of the slide we separated it from the rest of the echogram to make it clearer what we are talking about. The scale value of the ruler is not constant and should be estimated based on the scanning depth. In our case, there are 5 bars of the ruler on the screen. We divide the depth of 5.39 by 5 and get the division value of a little more than 1 centimeter. We visually determine the approximate half of the division and then the part corresponding to the size of the oocyte. In the presented example, we see that it is approximately 2 millimeters. Next, echogenicity scale allows you to understand the degree of echogenicity of the tissue based on the current scanner settings. Echogenicity characterizes tissue by the degree of reflection or absorption of ultrasound. This is an important characteristic, especially when identifying sex at certain stages and assessing the degree of maturity of fish. And the echogenicity scale allows you to understand how the areas that completely reflect sound, completely absorb it, or have moderate echogenicity look at the current settings. Next element. Focus position marker. Indicates at what depth the ultrasound is focused, and therefore the greatest clarity of the image is achieved. And finally, various service information, including the type and frequency of the sensor used, indicators of equipment settings, including the volume or strength of sound, the use of different software methods of image processing, date and time, and so on. This information usually differs from scanner manufacturer to scanner manufacturer and is better described in the manual. Orientation of the ultrasound transducer to the sides. How to understand where on the sonogram the right side of the studied gonad and the left side, or which part of the image is closer to the head and which is closer to the tail. All models of ultrasound scanners always have a special symbol on the screen, an orientation marker that allows you to identify the position of the transducer on the sides. This marker may look like the first letter of the name, a square, an arrow, or whatever, and is usually located in the upper left corner of the generated image. A similar orientation marker is also present on one of the sides of any ultrasonic transducer, regardless of its type. This marker is usually in the form of a tide, on a smooth surface, and is clearly identifiable to the touch. How it works. In order to represent the orientation of the transducer on the fish body in the course of diagnostics, the following principle is used. Markers on the screen and on the transducer should be on the same side. It means that if on the screen the marker is on the left side, then on the transducer when you hold it in front of you with the scanning surface downwards, the marker should be on the left side as well. In this way, aligning the markers on the transducer and the scanner screen will allow you to obtain on the screen not a mirror image, i.e. with a reversed order of sides, but one that corresponds to the real one. That is, the image border that corresponds to the left edge of the sensor on the scanner screen will also be on the left, and the right edge will also be on the right. When you move the transducer along the axis of the fish from right to left, the direction of image shift on the screen will be opposite, shown by green arrows, which, taking into account the features of our vision, provides a comfortable perception when studying the gonads in dynamics. In order to better imagine what we are talking about, it will be enough to try it once on a fish and everything will become clear. At this point, the minimum amount of basic information needed to start the work can be considered sufficient, and we come to the specific features of sturgeon diagnostics. But before we start working directly with the fish, we will briefly review the topography of the abdominal cavity organs. This is necessary both for proper insertion of the probe and for understanding what we see on the display. The first group are the abdominal organs that are most likely to show up on an echogram, even if you don't want them to. So, 1. Of course the gonads, ovaries of females and testicles of males, to study which the diagnosis is made. In the photo on the left, the gonads of the Siberian sturgeon at the stage of transition from the first to the second stage of maturity. It is most likely impossible to identify the sex of such fish, and it is difficult to simply capture a gonad of this size with a transducer. On the right, the gonads of a mature male sterlet. Diagnosis at this stage will not be difficult. 2. Next, duodenum, spiral intestine, and rectum. These organs will almost always be present when diagnosing small-size fish, but may also be found on echograms of large fish. Next we will show their difference from gonads, but for now it is important to remember that they are located between the gonads. 3. The pyloric gland, occasionally found on sonograms when diagnosing in the area of the pectoral fins, but easily identified. The second group, organs that will not fall into the scanning area by chance, and to see them on an sonogram, you need to purposefully choose the location of the transducer accordingly. These are the stomach, liver, gallbladder, and spleen. Next, what else is shown on the echograms? The kidneys are in the pictures number 9. The kidneys are located along the body along the dorsal surface of the fish body cavity. The right photo was taken from the abdominal side. In the left photo, the kidneys are dissected and we are looking at them as if through the back. Notice how close the kidneys are to the gonads. If the transducer is misplaced, the kidneys show up on the echogram instead of the gonads. Next we will see what the differences between the two are in imaging. And the last thing we can see in the diagnosis is the chordal sheath, number 10 in the photo. Let's move on to the practical aspects of placing the transducer on the fish body. If you do not have any experience in ultrasonic diagnostics, the best option for the initial placement of the transducer may be as follows. The fish is laid on its side, ventral side out. The transducer is taken with the open palm, so that the fingers protrude over its lower edge for 1 to 3 centimeters. The hand with the transducer is placed on the fish so that the finger pads protruding behind the transducer fit tightly to the abdomen and the vertical axis of the transducer is perpendicular to the body surface. As you move the transducer along the fish's body, the fingers also remain on the abdominal side, which helps keep the position at the edge of the torso and the angle of the transducer unchanged. The optimal place for the initial placement of the transducer is the edge of the lateral surface of the body in the area of 2 to 5 scutes from the pelvic fins, counting towards the head. We marked it on the photo with a yellow dotted line. This is the extreme position of the transducer on the tail side. There is no sense to place the transducer closer to the pelvic fins, because in this case we can see only the end of the gonad on the screen. Further, from this position, the transducer is moved towards the head, slightly changing the tilt angle, trying to avoid sharp movements. In order to correctly determine the sex or stage of maturity in the process of diagnosis, the transducer is moved along the body of the fish in the place of localization of the gonads. In the video we are holding the transducer by the upper edge. This is done only for demonstration purposes, so that it was visible that the scanning area of the transducer is located at the edge of the body, and the transducer itself is located almost at right angles to the surface of the body. You can see on the scanner screens and the monitor next to it that the transducer moves along the gonad and there is no loss of the gonad. For full coverage of the entire gonad volume, the angle of the sensor is also changed slightly during the longitudinal movement. And we proceed to the principles of gonadal capture. Let us immediately agree that at this stage we do not consider fish with gonads of the beginning of the second stage, and even more so the transition from the first to the second stage. It is practically impossible to start mastering diagnostics at these stages, and besides, it makes no practical sense. From an economic point of view, the first division of fish by sex is advisable when most of the fish have reached marketable weight. Usually, by this point, the gonads are well formed, and from this point we will begin our training. How to understand whether you succeeded to capture a gonad. The image of the gonads as well as other internal organs on sonograms is in principle similar to their appearance. And if the gonad has a heterogeneous structure, we observe this heterogeneity on the sonogram. Now directly about what we see on the sonograms, based on the assumption that the transducer is set correctly and that the scanner screen shows exactly what we want to see. We will also consider variance with incorrect placement, but later. So, the classic sonogram of a longitudinal scan of the reproductive system of sturgeon. 1 at the very top of the image, very thin, skin and subcutaneous tissue, visualized as interspersed dark and light bands. 2 below is a fairly wide band, this is muscle. This may be both an area of rather homogeneous color with moderate echogenicity, i.e. different shades of dark gray, and a band divided into separate segments, muscle myomers. Myomeres of muscles, depending on both the species and peculiarities of fish, as well as on the location and angle of the transducer, can either be clearly pronounced or visualized by a solid band of different shades of gray, but in any case, the upper part of the image on the sonogram, located above the bright enough thick light line, is the muscle. On the left sonogram we see their characteristic, visually recognizable, muscle pattern. On the right sonogram in the upper part it is just a stripe, and in the lower part of the gonad we already see the division of the musculature into segments. Let us return to the structure of the sonogram. Next, below the muscles, the lining of the abdominal cavity is displayed. This is a dense multilayer membrane, which is visualized as a very bright, rather thick, almost straight line. And this line is actually the boundary from which the image of the gonad begins. The display of the gonad on the sonogram depends on many factors. First of all, this is, of course, the sex of the fish and the stage of maturity. Nevertheless, even for fish of the same maturity stage, the image may differ at the beginning and end of the stage, for young and old, fat and thin fish, and so on. Generally, the gonads are visualized as a wide strip occupying a significant area of the display and including, in most cases, structures with different echogenicity. Further, we will consider in detail the elements from which the image of a gonad is formed on the display, but for now we will limit ourselves to this general description. Below the gonad we can in some cases observe the intestine. In this case, the walls of the intestine are visualized as bright light lines, and its contents as a gray stripe. And even lower, depending on the size of the fish and the depth of the scan, we may see the second gonad and then the lining of the abdominal cavity and muscles. This pattern is usually seen in sterlet scans. When scanning larger fish, the transducer usually captures only one gonad. Structure of the sonogram in the transverse scanning. Transverse scanning is a diagnostic mode in which the transducer is placed on the body perpendicular to the axis of the body. In this case we see a different location of the organs. At the very top of the sonogram we also see skin bands, but the muscles below are visualized in a larger area of the sonogram and are in the form of a wide arc-shaped stripe that goes to the left or right side, depending on the position of the transducer. Then the lining of the abdominal cavity is displayed, which also has an arc shape when scanned transversely. Under the lining of the abdominal cavity we observe a group of organs in which the gonads are central when the transducer is correctly positioned. Gonads are visualized in the cross-sectional skin as large oval bean-shaped structures. Due to the cross-sectional view, both the generative tissue and the fat reserves are clearly visualized on the displayed gonad fragment. And due to the fact that we see a slice of the gonad as a whole, we can judge quite reliably about its physical size, which often helps in determining the stage of maturity. In addition to the gonads, in the central region of the sonogram we can observe the intestines, which are visualized as a circle with a bright shell and gray amorphous content, as well as the kidneys, which are visualized as diamond-shaped or triangular gray structures without clear borders. Kidneys and dorsal aorta. The kidneys are located in close proximity to the gonads and have a similar visualization on sonograms. Although the kidneys are not the subject of diagnosis, we will focus on their description in detail, because it is important to learn how to unmistakably separate the renal and gonadal images. In the longitudinal scan, the kidneys are visualized as smooth dark gray ribbons with well-defined granularity. Closer to the caudal, the kidneys merge into one. On the outer side, the kidneys are covered by the lining of the peritoneum, which looks very similar to the sheath of the testis on the echogram. An important difference in this case is the geometrical shape. In the case of the kidneys, it is always a fairly straight line, while the sheath of the male gonad has a wave-like shape with varying degrees of curves. Under the kidneys is the dorsal aorta, from which the genital artery and the abdominal fin arteries, large blood vessels clearly visible on sonograms, depart closer to the abdominal fins. Often in these vessels is clearly visible blood movement, by which they can be easily identified. A little later we will show this in dynamics on video sonograms. In the transverse scan, the kidneys are easily identified because in this projection they are located lateral to the gonads. We will now highlight their location with a golden outline. And we will remove the highlighting so that it does not interfere with the view. On a transverse scan sonogram, the kidneys are visualized as dark gray triangular or diamond-shaped structures that do not have their own sheath. Cord. Usually a cord is displayed only during transverse scanning, but even in this case it occupies a small place on the sonogram when the transducer is correctly positioned. As on the previous slide, we will mark with a yellow line the localization of the cord display on the echograms, and remove the selection so that it does not interfere. The cord is visualized as alternating light and dark rounded structures surrounded by muscle. Note that on the same axis as the cord, but on the other side of the sonogram, an externally similar rounded structure is visualized. It is the intestine. Unlike the cord, it is not surrounded by muscle, but by gonads. When the transducer is correctly positioned, the image of the cord is blurred and located closer to the left or right edge of the sonogram. If you see the cord quite clearly and close to the center of the sonogram, it is likely that you have not placed the probe correctly. Cord. Usually a cord is displayed only during transverse scanning, but even in this case it occupies a small place on the sonogram when the transducer is correctly positioned. The gonads of sturgeons are rather intensively supplied with blood, and there are several large blood localization of the cord display on the echograms in the part of the gonads closest to the tail, so that it does not usually used for diagnostics. The cord is visualized as alternating genital artery, rounded structures surrounded by the sonograms. Note that on the same axis is visualized as a thick bright line running parallel to the abdominal wall. Similar rounded structures and sheaths or sides of other internal organs, such as the intestines, it is not surrounded by muscle, but by gonads. If you observe an element that you cannot reliably identify and that prevents you from making a decision and located closer to the left or right edge of the sonogram to the body surface, if you see the cord quite clearly on the other side to the center of the sonogram, it is likely that you have not placed the probe correctly. Principles of sonogram analysis. The determination of sex or stage of maturity is based on the analysis of the gonad image on an sonogram according to a set of structural and geometric parameters. For this purpose, characteristics such as tissue echogenicity, i.e. the ability to transmit, absorb, or reflect ultrasound, are evaluated on the basis of image characteristics. For example, fat, as well as fluid contained in the eggs completely absorb ultrasound and appear on the sonogram as an area of black color. In contrast, the generative tissue of male testes reflects most of the sound waves and is visualized in most cases as a very light area. Shells of cavities, vessels, gonads of males and eggs, completely reflect sound and are visualized as very bright white stripes. Accordingly, tissues with different permeability of ultrasound are characterized by the degree of sound reflection or echo, and in the same way are called anachogenic, not giving echo or absorbing sound, hypochogenic, partially reflecting, and hyperechogenic, fully reflecting. This terminology will be frequently used in the future and you will quickly become accustomed to it. Next, the visual homogeneity and density or graininess of the image is evaluated. What is meant? On the lower sonogram we see a visually quite homogeneously colored fine-grained band, which both above and below is tightly adjacent to the brighter envelopes. On the upper sonogram the same area is visually more loose, more granular, the color distribution is not homogeneous and can be compared, for example, with clouds, especially in the right part. Also on the presented echograms the geometrical differences of the displayed fragments of the gonad are clearly visible. First of all, this is the character of the lower edge of the generative tissue. On the upper sonogram it is as jagged. On the lower sonogram it is a smooth line. And the last important criterion is the presence or absence of a sheath of the generative tissue of the gonad. In the lower image, we see a well-defined sheath along the entire length of the gonad, and in the upper image, the margin of generative tissue is free, without sheaths. And now let us consider the previously described criteria of echogram analysis directly in relation to the issue of sex diagnosis. The main diagnostic sign of female gonads on echograms is heterogeneity of the visualized fragment of generative tissue, which depending on the stage of maturation can be displayed either as a kind of cloudy structure or as thin oblique stripes surrounded by dark anachogenic fat. And, obviously, at the stage of completion of maturation, female gonads are difficult to confuse with anything else, because the mature eggs are visualized in a fairly obvious form. An important sign is the absence of the gonad sheath. As we will show further, in males this shell is always present and well expressed. And another important criterion is the character of the margins of the generative tissue, which look jagged or rugged and have no clearly expressed borders both in the lower part and in most cases also in the upper part. The images of male gonads on sonograms also have distinctive features. The main characteristic features of males are rather high hyperechogenicity of the generative tissue, which determines the bright light color of testes on echograms, as well as the presence of a sheath tightly adhering to the generative tissue from below. Despite the fact that in most cases testes are characterized by a bright light image, at some stages of maturation the echogenicity of the generative tissue of testes can decrease and they look very dark on the screen. As, for example, in this sonogram. However, the echo-homogeneity of the tissue and the fine graininess of the image is retained. The sheath of the testes also remains clearly visible, which allows for confident identification of the sex even in this situation. Also, an important diagnostic sign is the geometry of the lower margin of the gonad, which is wave-shaped to a greater or lesser degree. For example, on this sonogram the waves are pronounced clearly. On this one they are less noticeable, but they are nevertheless present. Therefore, if we have correctly installed the transducer and selected the correct scanning plane and depth, then on the screen we see the previously described sequence, similar to the sonogram presented in the left part of the screen on the green background. In the upper quarter of the sonogram, muscles, then a characteristic bright stripe separating the abdominal cavity, and in the center of the screen, generative part of the gonad and fat stock accumulated in the gonads in various combinations. If the transducer is not installed quite correctly, or the scanning plane or depth is selected incorrectly, the images on the sonograms will be similar to those presented in the right part of the slide on the light red background. And now we will analyze such possible errors in more detail. Once again, let me remind you of the basic principles of correct positioning of the transducer. The angle is close to a straight angle, that is 90 degrees to the surface of the fish. The edge of the scanning area of the sensor is close to the edge of the body from the abdominal side. And now we will move on to consideration of variance of incorrect setting of the sensor and accordingly results of it. An important feature of ultrasound scanning is that the screen does not display the entire organ, particularly the gonad, but a longitudinal or transverse section in a plane passing through several organs at a certain angle. To select the desired direction of the scanning plane, the angle of the transducer is slightly changed within small limits. In the video we intentionally increased the amplitude of the transducer position change for clarity. In practice, a tilt of 5 to 7 degrees to one or the other side is enough, as indicated by the green lines in the photo on the right. So, variance of wrong transducer positioning. The transducer is placed very close to the tail. We see the kidneys converging from left to right. On the left side between them a light area of cartilaginous chordal sheath is visualized, and on the right side it is already absent. The muscles, on the contrary, become wider in the same direction from left to right. Another possibility is that the transducer is not positioned correctly. The transducer is far from the edge of the abdomen and the scanning plane is directed toward the back, which means the transducer is not perpendicular to the body surface. We see that in the upper part of the sonogram the muscles occupy more than 2 centimeters of 5.39 scanning depth, that is almost half of it. Below them we see the kidney and below that again the muscle. Proceeding from the fact that the kidneys are displayed already without division into right and left, the natural conclusion is the transducer is installed in the place of their convergence, that is, in the pre-tail part of the body. Capturing the kidneys instead of the gonads when scanning is quite a common mistake, and now in several ultrasound diagnostic videos we will try to explain the differences in the visualization of these organs in more detail. On this sonogram, we can immediately see that the transducer is installed incorrectly. First, the muscles above and below are not parallel, but converge at an angle, i.e. this is the caudal part of the body, hence the transducer is set too far towards the tail. Second, we observe the abdomen, meaning that the transducer is not positioned parallel to the axis of the body, but tilted toward the back. And, thirdly, it is far from the edge of the abdomen. We see the kidneys. A characteristic feature of the kidneys are the large blood vessels, in which we can observe the movement of blood. The kidneys themselves are visualized as smooth gray ribbons with homogeneous granularity and medium echogenicity. Another example of improper transducer positioning, when the scanning area is directed to the kidneys. Before us is an sonogram similar to the previous video. And now there was an important moment. The operator captured the gonad, but did not notice it and continued the movement of the transducer. We have a slowed down repeat of this fragment on the screen, and the lower gonad is visualized quite clearly here. In this case, the diagnosis in the beginning is quite correct. And the female gonad at the beginning of the maturity stage third is clearly visible. But then the operator begins to change the inclination of the transducer, and at some point the kidneys appear on the screen, which are visually similar to the male gonad. Therefore, it is important, even if you are confident, to pass the sensor along the entire gonad, and not to stop only on one fragment. In large fish, the kidneys on the sonogram may have an even greater resemblance to the male gonads or fish with gonads at the beginning of the second stage of maturity. The main distinguishing feature of kidneys in this case are large blood vessels, which we cannot observe during the study of the gonad margin when the transducer is properly placed. In the kidneys, these vessels are clearly visible. They can be either the cardinal vein or, as in this case, the dorsal aorta. When the transducer is stopped in such a location, the blood flow will be clearly visible, as we've seen in previous videos. Another common mistake when learning how to use ultrasound is to place the transducer far away from the edge of the body, tilting it toward the back. The photo on the right side of the screen shows this position. With this positioning of the transducer, the scanning plane is under the inner surface of the gonad, especially if it is small and we see only the muscles and organs of the abdominal cavity on the screen. As noted in the still image, the muscle occupies about 85% of the image area in the echogram. Obviously, it is impossible to identify the tissue under the muscle under these conditions. The operator moves the transducer along the body, but this does not produce a result. At some point, by changing the angle of the sensor, the kidneys appear on the screen. Then the scanning area goes to the intestines. We see the loose amorphous content between the multilayer shells, but it is not possible to identify the sex of the fish in this case. Another example demonstrates the importance of correct transducer positioning for correct diagnostics. A slow motion replay of the fragment shows that at the beginning the transducer was positioned incorrectly, far from the edge of the body, the scanning plane is directed to the kidneys, and then the angle of the transducer is sharply reversed, moving the scanning plane to the abdominal cavity. As the tilt angle changes, the gonad appears in the field of view, but the operator misses it. And the scanning plane is again on the kidneys. Then the transducer is returned to the vertical position, the gonad still appears on the screen, and you can confidently diagnose the sex of the fish. In this case it is a male. This video shows how on the one hand the correct angle of inclination of the transducer is important, and on the other hand, that the change of the angle should not be extreme, from one position to the opposite, and it is important to change the angle of inclination of the transducer gradually. Another possible mistake is skewing the transducer relative to the body axis. The picture on the right shows a slightly exaggerated version of this positioning, to give an idea of what we are talking about. In this case we observe a kind of adhesion of internal organs and practically only muscles are visualized on the sonogram. Changing the angle of the transducer in this case also does not improve the situation. Then the sensor is straightened, we see how the muscles move away to the edges of the sonogram, and after a while by changing the angle of the sensor, the scanning plane can be directed to the gonad, but because the sensor is far from the body edge, we see only the edge of the gonad close to the back as a narrow strip. Moving the transducer in the lateral direction allows us to see a larger area of the testis. But then the transducer is moved back to the dorsal area. Sometimes the cause of incorrect gender recognition may be interference caused by abdominal scuttles. Bone tissue of scuttles does not pass ultrasound, as a result of which an acoustic shadow is formed under them. Such shadows are visualized as vertical dark bands and are best of all noticeable exactly on light areas. In this area, these stripes are pronounced most distinctly and passing through the area of generative tissue, they create a visual effect of interruption of the light stripe and appearance of the cloud structure characteristic of females with gonads of the second stage of maturity. In fact, this is not the truth. If we move the transducer along the gonad to another area, we will observe a completely different picture. Here, despite the presence of shadows, the sheath of the testes is well distinguishable, and in addition, the shape and visual density of the generative tissue correspond to the features of the male. Another possible reason for difficulties in diagnosis is the presence of water-filled oviducts in the scanning field. In sturgeons, unlike many other fish, the sexual system is not connected to the excretory system and reproductive products are excreted outside the body through special excretory ducts, oviducts. The oviducts are located on the outer side of the gonads, pressed against the lateral sides of the body, and have the form of wide tubes ending in the front with a funnel. At the posterior end, the right and left oviducts close together and open outward with a common genital opening behind the anal opening. In some cases, a small amount of water enters the oviducts during the manipulation of the fish, which absorbs the sound rays and is visualized as elongated black areas. If you observe a picture similar to the one shown in this sonogram, it is advisable either to move the sensor closer to the head or to turn the fish on the other side. And to conclude, what else can help you assess whether you are diagnosing correctly or something is wrong? On this slide we collected sonograms made by our student during the diagnostics of the breeding group of Russian and Siberian sturgeon hybrid. All examined fish were of the same age and approximately the same weight of 3 to 4 kilograms. It is clear that in a group of fish of the same age kept in aquaculture conditions, despite individual variability, a cardinal variation of sexually mature stages is unlikely. Thus, if in some fish in such group we observe conditionally classical display of gonads on the sonogram, as it is shown in the left part of the screen on the green background, the appearance on the screen of images similar to the sonograms in the right part of the screen, respectively on the red background, indicates an error. And in cases similar to the sonograms presented in the middle part of the screen, it makes sense to specify the position of the transducer. As a matter of fact, the point I wanted to make is that it is important to consider such parameters as fish age, even approximate one, size and fatness while doing diagnostics. Based on these data you can predict for yourself at what stage of maturity the gonads may be, their approximate size and appearance, and respectively how they can be displayed on the sonograms. In this case, if the image on the scanner screen will be too different from your predictions, it makes sense to examine the fish more thoroughly. This is the end of our work session. Thank you for your attention. I thank everyone for their participation and invite them to our other online events.